Hi, today's topic is an introduction to pathology. Pathology is the science that deals with diseases. The term pathos in Latin means suffering, whereas logos means study. The four main concepts of pathology are: number 1, etiology or the cause of the disease; number 2, pathogenesis or the mechanism of the disease, or in simple words, the story of the disease. The third one is the morphologic changes or the reflection of pathogenesis, which may be further classified into gross changes or the observable changes and the microscopic changes. And lastly, the consequences of the diseases, which may lead to further complications. Now we will discuss about the methods used in pathology, gross examination and microscopic examination individually. Gross examination consists of two steps: identification of organ and identifying the pathology. Some useful gross features for examination. We can memorize it with the help of a mnemonic: double S and double C's. S stands for size. Remember, 2.5 centimeter is equals to 1 inch. Second S stands for shape, may be round, irregular, or stellate. The first C stands for consistency, such as whether the specimen is soft, firm, hard, or indurated. And the second C stands for color. This is a very critical point in pathology. Now moving to microscopic examination. Basically, there are three types of microscopic examination techniques: light microscopy, ancillary techniques, and molecular techniques. Hematoxylin and eosin stain is the standard stain of light microscopy. Always remember, eosin stains pink. These bind to the protein molecules, and hematoxylin, they stain blue or purplish in color, which bind to the nucleic acids and the calcium salts and other compounds. Other stains of light microscopy are iron stain, which gives a Prussian blue color. Secondly is the trichrome stain, which stains with the cells and connective tissue. For example, in smooth muscle cells, it gives a red color, and connective tissue, it gives a blue color. Amyloid stain, which gives a Congo red color. Acid fast stain, which is reactive with acid fast bacteria, or it is also known as Zell-Nielsen stain. For tuberculosis, it is used. A periodic acid Schiff stain, or PAS, it stains with compounds containing high carbohydrate molecules, example in fungi. Gram stain, as in gram-positive or gram-negative bacteria. Reticulin stain, these stain with collagen type 3 molecules. It gives a black appearance. Immunohistochemical or the antibody stain, also known as the epoch stain. These stain when it is bound to a specific epitope. The ancillary techniques are of two types. The ancillary techniques are immunofluorescence technique, the transmission electron microscopy. Don't worry, as we will talk about all these techniques in further lectures. And the last technique is molecular technique. Here we use protein electrophoresis, southern western blots, polymerized chain reactions or PCR, cytogenic analysis or karyotyping, in situ hybridization studies. Always remember, any disturbance in homeostasis leads to pathology, and pathology, it equals to stress. Stress leads to adaptation, and adaptation leads to cell injury. Cell injury may be irreversible or reversible. If irreversible, it may lead to cell death. Well, that's all for now.